What's up, everybody? Jason Goodwin here. Today, we're going to talk about evidence-based practice and nursing theory and research. How about that? So, jumping right in, we're going to discuss a few things that you might be familiar with. So, a couple things we talked about Benner in her book Novice to Expert. Um, Watson has the Science of Human Caring, and it's just a care model. Those are some of the main people in nursing theory that are preeminent. As far as nursing theory, it's nothing more complicated than an observation of facts. And the theory itself is not a fact. It's a way of organizing and viewing a phenomenon. And the concepts explain how they're related or linked. So they assist us in finding meaning in our experiences, organizing our thinking, and developing new ideas into the insights of the work. So it helps drive us in improving our care model in one way or another. As far as the components of a theory, we have assumptions, and those are ideas that we take for granted, right? When we assume something, they're ideas that you presume and to be true, and you intend to test that. Then there's a phenomena, subject matter of a discipline, and it's marking the boundaries of a discipline based on identifying a unique idea from another. And a concept is a mental image of a phenomenon. So if there's a care concept you want to make, you identify what that ideal state would look like, and you're generalizing an abstract idea from that situation or what you might expect to see. And then a definition is a statement of meaning, an operational definition, they often call that clarifies what you're trying to do and what some of the specifics of that theory are, and it might be general or specific. And then the statement or propositions that will describe some of the linkages or interactions among the concepts. And these statements taken as a whole make up the theory. All right, so what's a paradigm? So a paradigm is a way of thinking that's shared by a community. And these communities are usually scholars who are studying and working on the same phenomena. So this is something that you do in your doctoral practice. You work on developing new ideas with this. A conceptual framework is a set of concepts that are related to a pattern or a whole. And so these frameworks tend to be broader and more philosophical than theories. And frameworks are something that can be used as a construct to develop movement. And then a model is a symbolic representation of a framework or concepts. And so we talked about a care model being a total care. So that's a model that's based on many different potential theories, but the idea is that the nursing-centric aspect of it is somehow going to improve the end result. How are theories developed? Well, a researcher has an idea to explore, and they use different types of reasoning. So logical reasoning is the purpose to develop an argument or statement based on evidence that will result in some sort of logical conclusion. Okay. There's two different types of this. You could call it inductive reasoning or deductive reasoning. Inductive reasoning is where you gather separate pieces of information, you recognize a pattern, and form a generalization. Induction thinking is I have a specific idea out there or data, and I'll bring it in and make a generalization. Deductive reasoning is it starts with a general premise and moves towards a specific deduction based on taking in facts. Inductions and deductions are not facts or truths by themselves. They're the point where you take something and go in a direction in seeking the truth. And the way that you develop that is the difference. So a clicker check on some of these ideas. A patient has pitting pedal edema, cracks, and elevated blood pressure. The nurse concludes that the patient has a fluid volume excess. Which type of reasoning did the nurse use? So theoretical, inductive, deductive, or conceptual? Well, we didn't talk about theoretical or conceptual reasoning, so we're stuck with B and C. And I would choose B on this one. And the reason for that is inductive reasoning involves drawing a general conclusion from a pattern found in individual pieces of information. All right, so logical reasoning. This slide shows the comparison of inductive versus deductive reasoning. Theorists and nurses in practice use both, but so for instance, you have a elevated WBC count and all of these ideas, and your conclusion is the patient may have an infection. Over here, I know that infection causes these things. This patient has a diagnosis of a kidney infection. I will monitor the temperature and WBC, right? So that's the difference, and you'll use both depending on how you receive that data. All right, so essential concepts in nursing theory. So a person, these are ideas that you're going to be considering as you work through your research journey. Who is the person involved? The person represents the population or the person that you're studying. The environment, what was the environment? Is it a community center? Is it a bath in a nursing home, right? Or a process related to that? Is it a bedside at the hospital? Health, what's the health condition of the person? So is a person, in chronic conditions? Are they in pain? Are they ready to discharge? And nursing, how is this nursing involved? So the nursing might have been compassionate, or maybe it wasn't appropriate. Was it a novice or an expert? Now we say research and theory, but keep in mind, these things are regularly used in our daily practice, even in, like we talked about performance improvement. So you'll use these as a general thinking process, and that'll take some time for you to get used to it. But to point it out is helpful, because you might not recognize it as this without this discussion. So as far as describing and explaining, so the theory that you use influences what you look for, what you notice, and what you perceive, okay? And so what interventions you'll choose are based on that. And so we use this in practice. Like I said, we'll use this in the hospital to guide these are limited in scope, but they'll guide your clinical decisions. Then you have educational institutions that help push these theories and help people understand. And then finally, research. These are things that will help generate new knowledge. And that's why we read research, right? Is to hear about the latest studies that are happening and consider whether those need to be put into practice. Okay, so the nurse incorporates Hispanic beliefs about hot and cold into their plan of care for their client. On which theorist is the nurse basing care? So as you've gone through the book, you'll notice that Madeline Leininger focused on transcultural nursing and developing cultural competence. So this was something that was present. Let's go back real quick. This is something that was present in I think it was, I don't know how far back, but quite a while back. And it focuses on the things that you might hear called different ideas, but diversity of culture is one of the things that was focused on there. And so that would be answer D there. All right, other theories. We've talked about Maslow's before. This theory identifies 8 different levels of needs and identifies that the lower levels must be met in some way before the higher levels can be achieved. And that's one of the ones that I want you to understand. The rest of them I want you to read and understand, but I don't expect that you'll have a high degree of memorization of those things. But Maslow's is important to understand as you move along. For nursing research, the purpose of it is to develop knowledge about issues that are important. So we have a systematic process for analyzing and encompassing that finding into the future of our practice. Why is it vital for us to base our nursing care on this evidence? Well, first of all, probably all of us have heard somebody say, well, we've always done it this way, or that's the easiest way. But we don't actually practice that way, right? We practice based on evidence-based research. So that means that when you are deciding what to do in your clinical environment, whether it comes from what interventions you use to what practice aspects you use, right? We did fit tests, and you understand that there's certain things that are related to a fit test to help keep it effective, right? And you understand that people that are wearing them in a certain way that aren't functional, there's been research to say that that's not effective, right? So that's research we use in our daily routine to help us. We verify that clinical practice decision and intervention with research. We can improve clinical care practices that way, and we can also dispel myths in clinical practice. We've used research to avoid errors and unintended consequences. The Institute of Medicine came out originally, we're going to go into this in a second, about errors in healthcare, and that was something that really wasn't understood at the time. So those are things that have helped move forward. All right, so why do we do research? Because it has a possibility of enhancing our patient's experience. The position of the ANA is that all nurses should be committed to the advancement and ethical conducts of our science. And the Institute of Quality and Safety Education for Nurses, QSEN, is an organization that is mostly focused on the quality and safety competencies for nurses. And it's involved in the way that we educate nursing students. The IOM, the Institute of Medicine, they have core competencies for healthcare providers in safe and effective nursing care. They also, as I said before, they initiated something that was related to errors in medical care, and that was done over a series of decades. But essentially, they talked about how high the rate of medication errors was in hospitals. It was much higher than had ever been communicated before. And so that met with a lot of controversy, and then eventually helped us change the way we look at care. But even today, I read some research the other day that said that the definition also depends on how high that rate is. And by this research, the definition was that 80% of all patients that stay in the hospital experience some level of caregiver error during their time. And so that's something that is really kind of something interesting to think about, and really should be worth considering. Okay, so what do? We have our associate's degree in nursing, our bachelor's, our master's, our doctorate. All of those things are advancing our level of knowledge in research. Once you get to baccalaureate degree in nursing, you're going to have statistics if you haven't had that already, and that's your first touch on nursing research. When you get your master's degree, there's definitely more training on research, how to analyze problems, how to apply evidence-based practice to nursing care, and then you'll have research projects and things. And then when you join your doctoral program, that's very specific to nursing researchers. So they, as a part of the program, conduct research. They apply that research to the clinical area. They develop ways to monitor it. And then they disseminate their research based on however they can once they finish their research. Ways to gain knowledge. So, okay, there's a couple different ways to do this, right? One is trial and error plus common sense. So try what makes sense to do. If it doesn't work, try something else. A lot of iterative changes, right? a lot of the best things in the world have happened as a result of trial and error. Then we also have authority and tradition. We rely on an expert to do or what has always been done. The third is intuition and inspiration. Intuition is a feeling about something, an inner sense. And then logical reasoning means using your knowledge and facts available to you form your conclusions. An example of some of the things that you might have seen out there, trial and error. There were times when doctors would wear their lab coat without cleaning it. They had blood and those types of things on it. And they thought it indicated their level of experience to their patients. Over time, they learned that that probably wasn't the best thing to do. And so that error created a movement in infection control. And so that created that, right? A lot of times in this country, we will use authority and tradition to guide our decisions, which means you rely on an expert because they're the person that knows, right? More and more society is realizing that you have to advocate for yourself. There are many amazing clinical experts out there and other experts, but none of them should be relied upon for your decision making without understanding the basics of what you're trying to decide, right? So authority and tradition is leads to a lot of errors, and I'd encourage you to play a part in any time you're considering that, so that you can be that other voice. What's a scientific method? Well, we probably went through this in grade school when we did our science project, if that they still do that. So that's a process where the researchers uses their senses and a scientific method, right, to describe and explain certain events. And the idea is, the goal is that you find out solutions to problems and develop those explanations based on that process. And there's two types of research. One is quantitative research and one's qualitative research. So quantitative research is generalized on populations, and it's very concrete in the way it's collected and in the numbers, right? And so you measure the results of that and data reported as numbers. Qualitative research is more focused on empirical information. So it's focused on lived experience. The sample size, of course, is much smaller, and sometimes there's interviews or focus groups, and it may be highly structured or even guided by open-ended questions where patients will give their information. The difference between quantitative and qualitative is oftentimes the qualitative research is not based on a large sample size. It can be skewed one way or the other based on the individual experience. So it's just important. There's places for both of them, but it's important that you understand when you're reviewing qualitative research that it is empirical in nature, and it is not a statistical compelling finding, right? It's more soft in your ability to learn from it. But in many ways it's helpful as well. So a nurse wants to know which best taping method is most secure in prolonging peripheral IVs in newborns. They plan to implement a qualitative study measuring longevity of the patient IV in hours. What questions might they ask when planning their study design? So this is kind of an interesting idea. So how would somebody do this? So they're trying to find out if different types of tape would result in a longer IV staying in, so that patients don't have to have them, especially little ones, don't have to have those restarted unnecessarily. So they might find a couple different taping methods, and they might follow those patients in a large enough sample to where they can infer something about it, and then measure the amount of time those IVs stay in based on that intervention, right? So that's how it works. They would implement a protocol based on what their findings are. Clicker check: a nurse researcher who intends to interview clients about the factors that influence their compliance with insulin therapy and summarize the data as themes is doing quantitative research. Is that true or false? So the key things in here is they interview clients about their influence over compliance with insulin therapy summarize the data as opposed to showing the data as themes. So you're putting it into buckets. That's empirical and it's more quantitative in nature. Okay. Now, a study that said the percentage of A1C increases based on this intervention, that would be more of a quantitative study. All right, so first in your steps, at the novice level, you'll be applying evidence-based findings, but not necessarily doing individual research. But when you start to do this, and you might do it through continuous improvement models, you select and define the problem, you search for information on the topic, you do your research, you formulate your question or your hypothesis, right? So I think that this is going to happen, or this is the problem, and here's how we're going to design a solution to research it and hopefully improve it. Then you collect your data, you analyze that data, and then you report the research findings. It's important to note that sometimes the research findings don't support your hypothesis, and that is part of the process. It doesn't mean the finding is necessarily a failure. It's just a research project that confirms something different than what you anticipated. All right, let's talk about rights of patients. There's a little bit of a misunderstanding of certain things with patients. Patients, when they're involved in research projects, we've probably heard about institutional review boards related to the Tuskegee experiments, for instance, and other projects where I think I can't remember the Stanford prison project where one set of participants was told that they were in some way superior, and that group started oppressing the other group based on that. And so those are the important thing to learn about those situations is the informed consent prospect of being in a research study. You have to be aware of what's happening. And so the 4 points of informed consent when it comes to research has to do with, number one, the right not to be harmed. If there is some sort of a possible outcome, then you should be notified. And if there is some sort of a harm that's identified, it's stopped immediately. Full disclosure, you should know everything about what's going to happen from, what's the compensation to what are the risks. And then self-determination is the right to say no. That doesn't mean we opt you in whether you want to or not, right? And then finally, the privacy and confidentiality means that you have the right to keeping that information and their identity protected, including de-identifying the results. Now, the way that these things are determined is and they call these IRBs, but every hospital has an IRB that does research. That's part of that process. And so at UC Davis, they do research, and there's a process for ensuring that an institutional review board has weighed in on your project before you can start. So when we identify clinical nursing problems, we'll use certain things to identify them, right? And this is not particularly scientific. It's just like, for instance, experience. That's something that you're curious about, and you might have seen it because you have that experience. It's a great way to identify things and how most research is identified. Social issues, you might have more of a social concern, a broader concern about something, and you don't have experience directly, but maybe you want to study that. You can use existing theories to try to test new ideas. You can have ideas from others, people that may want to fund the research or maybe have ideas that haven't been reviewed yet. And then you can do nursing literature reviews where you might review large amounts of research and you can identify clinical problems based on former research. Okay, so this acronym PICO, it stands for Patient or Population Intervention, Comparison Intervention, and Outcome. Okay, you may not always need the comparison intervention, but these are the steps toward your research, okay, and how to design the system. And when you're analyzing research, you're going to ask some of these questions. What's the book or journal or article about as a whole? What's the theme? How is it developed? what's being said in detail and how. So what's the author's main ideas? What are the arguments? In a research article, you might find this in the abstract or in the conclusions. And that's useful too, as well, in general, because you don't have to purchase the article in order to determine that. You might purchase it later based on that idea. And then what of it? Well, what's the significance? Is there any way to use that information to improve and apply it to patient care? That's an important question because that answers whether your research will be impactful or not. So we conduct research to establish a change in practice, okay? So true evidence-based practice requires us to discover and critique the best available evidence, all right? And you'll find that all over the place, and research can help us provide those reasons. All right, so here's some barriers to using research. Number one is our lack of knowledge in nursing research. That's one of the things that we're trying to address with this lecture, right? Negative attitudes towards research. A lot of people are very intimidated, but what I've learned over time is that you do research every day. You just don't formalize it as that. But anytime that you've been involved in some sort of a care improvement, that is a research project. It's just a matter of formalizing that process, putting it into a template so that you could easily communicate it in a scientific forum. Inadequate forums or opportunities to disseminate research. Nursing doesn't have this as much anymore. You have the ability to participate in that readily. And then lack of support from your institution. Many institutions don't provide any resources for that and things like that. So if you want to do it outside of your work, you can do that, but many people find that that's difficult for them to stick to. And then also study findings that aren't ready for the clinical environment. Sometimes that can be a challenge because it doesn't apply directly to what you're doing. And our last slide, basically what we want to say is that when you're thinking, let's just talk about this. Think of an experience you've had in a clinical environment, or maybe a clinical experience from a family member or yourself. Maybe it was taking vital signs or bathing a confused patient. Maybe you've seen some of this. You didn't do it yourself. Think about these four components of nursing theory that occurred, right? So imagine this situation in your mind. Who were the persons involved? You know, what roles? Nursing, CNAs. What's the environment, right? If they're taking vital signs and it's in a clinic, it was in an ambulatory care area versus an acute care. And so that might apply only to clinics. What's the health condition of the person, right? Were they very sick or only minimally sick? And would that be the population you'd be studying? And then how is nursing involved in that? And then that basically gives you an idea of how applicable or where that would be applied to. Okay, guys, so that's all for this lecture, and we'll go from there this week. Good luck on your exam.